The next skill we have here, go to page 35. Provides mouth care, skill 20. Skill 20 has a critical element. The critical element says, step 8, cleans mouth, including tongue, and all surfaces of teeth using a gentle motion. All right, so watch and learn. This is my GNA exam. I go to my patient once again. Hi, Ms. Nafisa, I'm here to brush your teeth. Is that okay with you? I'll be right back. For this skill, these are your equipment. You're gonna get an emesis basin. You're gonna get a washcloth, which will be acting as your bib. You're gonna get toothbrush, toothpaste, and a cup of water. Okay, the water is provided for you over here, so you just get your cup and put some water in it. You would also need a pair of gloves. If your question is, am I gonna wash the client's teeth for real? The answer is yes. Okay? For mouth care, the head of the bed comes up again. I'm gonna be standing by the wall so that everybody can see this. Just like I said, mouth care has a critical element. The critical element says you're gonna brush all the surfaces of the teeth, and you're also gonna brush the tongue. You might miss it. It also says do this gently. That's why I was emphasizing. Almost like range of motion for knee and ankle, and range of motion for one shoulder. The critical element says gently. So if you do it too fast, do we have a problem? Yes, all right? Because if you remember at the beginning of the skill demonstration, I told you, you have to do a critical element for a skill that has one. And you also have to do the critical element correctly. Just because you perform the critical element doesn't mean you get credit for it if you do it incorrectly, all right? So watch and learn once again. Put the bib on my patient over here, glove up. You don't have to write any of this because you're just watching me. Okay, everything is demonstrated. When you are taking the toothbrush out of the sleeve, the plastic sleeve, okay, don't touch the bristles. This is going into somebody's mouth, so you can just pierce it with the toothbrush itself, okay? Before you put toothpaste on the toothbrush, you would wet the toothbrush. This patient over here did brush their teeth before they came, right? Your classmate. So don't put too much toothpaste on the toothbrush or else you'll be here forever. Rinsing it. And we want to finish our GNA exam on time, okay? Once you put the toothpaste on your toothbrush, you are going to be holding the emesis basin, also known as a kidney bowl, okay? Also known as a spit bowl, close to your patient's lips, and you're going to give your patient instructions so that you will pass this successfully. None of us have perfect teeth, so if you are a patient for someone and they ask you to open your mouth for them, please do. Don't just sit there and do this and then the person fails the exam all because of you, all right? The first instructions I'm going to give my patient is, Miss Nafisa, can you do cheese for me? Okay. So this is what you would do. Gently. Of course, I'm speaking because I'm teaching. You will be doing these skills quietly. Now open your mouth. Very good. So when your classmate tells you to do don't bring your tongue out. Just open your mouth You brush the lower enamel, then you brush the top, okay? Now, can you please bring your tongue out, stick your tongue out. When they ask you to bring your tongue out and you stick your tongue out, you, the CNA, will just brush the lower part. Don't go all the way to their throats, obviously, or else they will gag, right? Okay. You're done. You did the critical elements correctly. Once I finish brushing the tongue, I'm going to ask her to rinse and bend her head down and spit in the kidney basin. I'm holding, Officer, hold the water, I'm holding the toothbrush on the side here, okay? So you can use that trick. I'm going to do this so you can see. So be a great patient for each other in this manner. Thank you. After she spat, I'm going to use the washcloth to dry her lips, not rubbing, but what? Dabbing, okay? Very good. We are CNAs on the nursing team. You know this is what we do. Okay, so this is not a problem. When you finish, this is considered disposable. The examiner is going to dispose of the toothbrush, okay? But you would put this into the trash bin, the washcloth into the hamper. I'm gonna go to the sink, which I will show you later when the recording is over, and rinse this and rinse the toothbrush as well. For now, you don't have to come with me, okay? But that day, the examiner will come with you. When you get here, just pour the contents of your spit bowl into the sink, rinse it, and rinse the toothbrush as well. Dry the emesis basin. I'm going to wash my hands. You go back to the examination room and the examiner follows you. When I come back, as you see, the examiner has designated an area outside of the classroom that he or she has determined as the dirty utility area. So any equipment that you take out to wash and rinse and dry, you leave it at the designated dirty area, all right? That's why I'm not coming back with any of the equipment, okay? Get rid of my toothpaste paste. Like we said, you should put it back where you found it. If I have speck of water on my table, I can clean it with paper towel or washcloth and return my patient back how I found them, okay, in the lying position. So some of these skills, obviously, you can also practice at home if you have family members who can allow you, but you are still supposed to come to school to practice so you can take command of the environment. Okay, the more you practice here, the more you be used to the equipment and the environment, so that day we will not be too nervous, all right?